It has been 18 years now since Colorado voters legalized medical marijuana, and researchers continue to make new discoveries on pot's impact on medical conditions.
CBS 4's Jamie Leary introduces us to one reluctant patient who volunteered to help us out.
An airman and then a businessman. Marijuana was not something on Gary Griffin's radar. Through the years, he never had an urge to experiment with it.
It was the devil's weed. It was awful to me.
When Griffin was diagnosed with Parkinson's disease, he was suddenly open to anything that might help him sleep and stop his hands from shaking, even marijuana.
First drop, may not survive. I may go wild kicking off the balcony.
But Griffin agreed to enroll in a cannabis study with his neurologist, Maureen Leahy.
We legalized medical marijuana before we actually knew that it was effective for medical disorders.
To find out if medical marijuana would help the symptoms of Parkinson's, Dr. Leahy gave her patients CBD oil stored under lock and key at the University of Colorado Hospital. Many of her patients had positive effects.
But they had a reduction in our assessments of their motor symptoms, and they had improvement in their nighttime sleep.
For Gary, there was only a small improvement with the shaking in his hands.
I hoped for a miracle, but it didn't happen.
But he saw a dramatic improvement in his sleep.
Once I started taking CBD oil, I never had a sleepless night because I couldn't relax my muscle groups.
So much of an improvement, the man who called marijuana the devil's weed started growing it and processing his own CBD oil at home.
I'm not a stoner, but I am a proponent.
That was Jamie Leary reporting. In addition to Parkinson's, Colorado researchers are trying to determine if marijuana helps with sleep, pain, and epilepsy. Dr. Leahy plans to kick off a much larger placebo-controlled Parkinson's study in the coming months.